This is Dr. Christopher Wood here at Arizona Sports Chiropractic, and today we're going to talk about one of the most important concepts that's vital to all the exercises we show our patients, and that's a concept of diaphragmatic breathing and intra-abdominal pressure, what we call IAP. The way we're supposed to breathe is to use our diaphragm, which is our breathing muscle. Now, our diaphragm sits like a big manhole cover under our ribs, and when we breathe properly, it descends. That creates a negative pressure in our chest that allows us to bring air and oxygen into our lungs effortlessly. And what it does is it increases this intra-abdominal pressure through a co-contraction of all the core musculature. It's this intra-abdominal pressure that stabilizes our spine and also gives us a very good base of support for any movement of our arms and legs. So if you want a good, positive, strong core, you have to be able to use your diaphragm to breathe and develop good intra-abdominal pressure. Now today we're going to show you two very simple ways of one, assessing your own breathing, and two, a position that we think it's easy that will help you cue yourself to breathe the right way. Okay, we have April helping us out here, and to assess your own breathing, what you want to do is lay on your back with your knees bent, arms at your sides. You're going to take one hand, put it over your abdomen where the belly button is, and put the other hand over the chest. And the first thing you want to do is just relax and breathe normally. Now, if you're using your diaphragm to breathe and you're breathing correctly, what you should see is the hand over the abdomen moving up and down. And the hand here over the chest should be nice and silent. It really shouldn't move at all. Now, if you notice the opposite, where the hand over the chest is moving and the one over the abdomen is silent, then you're using your chest to breathe and you're not utilizing your diaphragm to breathe correctly. Now we have a very good exercise that's very introductory that you can start on, do it yourself at home, that will help you connect your brain with your diaphragm and develop some diaphragmatic breathing. And also it's a stretch as well, so it'll help you as a good warm-up anytime you want, just waking up in the morning or before playing golf or even after. So we're going to have April get on her hands and knees here, and go ahead. And she's going to tuck her elbows into her knees and sit back on her heels. Now this is an ideal position. If you cannot get into this position, it's not that big of a deal. Just alter it. Only go back as far as you can. So if this is the far as you can go back, then you're going to start there. But what you're going to want to do is take an object, a rolled up sock. We're going to use a lacrosse ball in this instance. And she's going to tuck it in because you want to bridge the gap between your abdomen and your thigh, because what we're doing is we're using our thigh as a cue to help us learn how to breathe. So in this position, she can feel her thigh, and she's going to inhale and she's going to push that abdomen into her thigh, and then exhale and relax. And inhale and push, and no matter what object you're using to bridge the gap, just push your abdomen into that object. And just inhale and push in, exhale and relax. Now one thing you're going to notice too is when you're breathing correctly, you're going to be breathing circumferentially, so all the way around, not just through your stomach. So when April breathes in and inhales, you could see that her back's expanding as well here, so you want to expand all the way around. So this is a great exercise to hook your brain up with the diaphragm, stretch some of these back muscles that are through compensation getting tight because of lack of intra-abdominal pressure and core stabilization. And it's just a nice overall stretch and warm up. So you can practice this yourself at home. Really work hard on pushing into those thighs and using that cue. Now, if you feel that you're doing it pretty good, you can try to take the next step, and what she's going to do is inhale and push into her thighs, and she's going to hold that pressure, and at the same time she's going to breathe. So she's keeping that pressure into her thighs while she's breathing. Now this is a little more advanced, but it's something you can try on your own if you feel like you have the breathing down on your own pretty well. If you come into the clinic for your free consultation exam, we're going to do many more tests to further evaluate your core, and we have a lot more exercise and positions for you to try to help you develop good core strength and stability. So until next time, thanks for watching. Have a great day.